Okay, here's another great question. 60-year-old man presents to the emergency room with persistent nausea, vomiting, and postprandial pain. This has worsened over time. The pain is crampy, and after hours and meals, relieved by fasting. We got mild tenderness of the epigastric region. Okay, there's a mass in the third portion of the part of the duodenum. Okay, so let's look at this. The third part of the duodenum here. So there's a duodenum, and this little third part is going to be right here by the SMA. And so super important to note which of the following is most likely to be compromised. And the answer is indeed going to be the SMA. So let's talk about why it's not the other ones, like the common bile duct and other answer choices. So the common bile duct is located on the posterior to the first part of the duodenum within the head of the pancreas. And so it's going to be affected by the pancreatic masses here. So that's where the common bile duct is, and it's more pancreatic-y. So that's not going to be the answer. Gastroduodenal artery. This is a good guess, but this is posterior to the first part of the duodenum. So it's going to be posterior duodenal ulcers in the first part, not the third part. So that first part, yes, gastroduodenal, it's definitely up there in that first part. Second part, the pancreas kind of swells a little bit. And the third part, you start interacting with the SMA. Portal vein, nada que ver. Nothing to see about the chordal vein there. That's formed by the union of the superior mesenteric and the splenic veins. So it's located at the posterior to the pancreas, but it does not have any close contact at all with the duodenum. So the portal vein, not touching the duodenum. So we're good there. The left ureter, this is not related to the duodenum. The right ureter passes posterior to the second part of the duodenum. And so maybe you'd think that, but yeah, no. The left, not even related to the duodenum at all. And so yes, the SMA. So if you have a third part of the duodenal mass, you can compress that SMA and causing ischemic events, compromise the vasculature and cause like bowel ischemia. So the correct answer is indeed SMA. We'll scroll down and kind of see some of this stuff here. First part, second part, third part. You can dive into that if you want. But essentially, that's the gist of it. So hopefully this is helpful. If it was, then like and subscribe.